طلاب تسمعوني؟
نعم دكتور.
كالمعتاد اكو غياب، بس مع ذلك راح نبدا لانه صار الوقت بس 11 دقيقه. بدأ عندكم الفريكونسي؟
نعم دكتور بدأ.
Okay. Today we will take a session about the slides. Yes, we will focus on the neonatology slides, but the instructions I will give you now, it is important and you can adopt it in any question of slide. Slide questions is a fixed station in the OSCE examination. And it is very important. The slide may be a picture, maybe a radiology, X-ray, or MRI, or CT scan. Slide may be a sample of blood film, maybe a test of urine, maybe an ECG, maybe an EEG, maybe something. So always there's a question linked to the slide. Sometimes the slide is very important and the finding on the slide is very clear. So the question here, it will be directed on the slide itself, what we call it the spot diagnosis. And in these cases, there will be just a question, not something to explain or to help you reaching the answer. But sometimes the slide give you a finding which is not specific to the condition we want you to know in the question. So we give you a small or a short notes about the history or about the slide, helping you in the answer. So according to that. Sometimes the questions directed on the finding of the slide, but sometimes the question is directed on something you should know the slide itself, then you will answer. For example, if I give you a slide of a child with measles, for example, but ask you about the management of this condition or the late complication of this condition. So firstly, you have to know this is measles, then you have to answer the question of the management or about the complication. In such cases, if you just say, or if you just write this is measles, it is not enough to take the mark of this question, because I want you to know the question related to the measles, not to the measles itself. But sometimes I give you a slide of measles, the same, but I give you a complex spot, which is a sort of an anthem that is appear on the oral cavity before the appearance or eruption of the rash. So sometimes I just want you to know this is a complex spot. So what is the finding on this slide? You might say this is complex spot and this is enough for this type of question. So according to that type of slide and according to the notes come with the slide or given with the slide, you know what is the task. But in each type of slide, you have to, with yourself, we have to prescribe the slide you see, and you have to analyze it, especially if you see it for the first time. Because in this session and the next session, I will give you a group of slides most of them are pictures. But the aim is not just to keep it in your mind, these pictures, because when I give you an example of cephalohematoma, there are more than 100 slides of cephalohematoma. So it's not necessary I will repeat the slide given here in the examination. But if you analyze, or if you know how to prescribe a slide of cephalohematoma and analyze the abnormality you see here, you can answer other slides for other pictures or other neonates having the same problem. This is the principle of how to answer the slide. نشوف من يريد يدخل وليش كان متأخر. يعني السيشن موعده بالثنتين وانت جاينا بالثنتين و16 دقيقة، احنا دخلنا متأخرين. اين كنت يا مهند احمد اسد؟ نرجع نكمل او نبدأ بالسيشن مالتنا. هسه عرفنا ال principles of how to answer slide questions. We will start with this group of slides. So, for example, because we have no time, I will only comment on the slides. For this example, firstly, I have to prescribe this picture. Here I can say this is a neonate, newborn. What's abnormal or what's wrong with this neonate? Of course, as you see here, there is a lunar shadow, well demarcated, red shadow, or like a horseshoe, on his cheek. So, for a neonate, what it could be the cause of this redness, or what we can call this redness. If we found redness on the face of the neonate, of course, the redness here is erythema. When we found redness on the skin, it is erythema. So I have to analyze erythema found on the cheek of neonate. And the shape of it is like a horseshoe or like a lunar shape. So I should know, or I should expect, this is because of a forceps application on the face. So if this is a forceps application on the face of this baby, this is mean this baby is a product of difficult or assisted vaginal delivery. And this is a type of soft tissue injury that may cause because of the application of the forceps. And this is maybe erythema only, or it may also comes with abrasion of the skins. And this is a soft tissue injury, as I said. And it is a self-limited, meaning require no treatment and resolve within the few days of life. So this is an example of erythema abrasion. And there is a lot of examples like this. Now we come to this slide. Again, I have to analyze what I see, or I have to prescribe. This is a neonate, of course. The shown part of his body is the face, from his nose downward, the neck, and the chest. And then for focusing for abnormality of this baby, of course, my eyes will go on these red dot spots on his neck and even on his upper chest. So when I found the red dot spots on the skin of any person, the interpretation of this is petechiae. You know the petechiae, it is a capillary hemorrhage, subcutaneous hemorrhage in the capillaries, and it is represented as a red dot spots in the skin. So presence of these petechiae in the skin of the neonate, and especially around his neck and upper chest. This is also type of soft tissue injury because of difficult labor or abnormal labor. Like if the baby, it was of nuchal cord around his face, around his neck, so causing pressure leading to this capillary hemorrhage, or because of the breech presentation, or because of what's called the precipitous delivery. Precipitous delivery, I know you know it, which is a very rapid second stage of labor. Very rapid stage of labor. Just 1 to 2 hours. Between the inside and outside. So the result goes capillary tiki. Presence of tiki few days after. But the significant presence of tiki, it may be because of thrombocytopenia also causing petechiae. So how we can differentiate between both? Firstly is the presence of petechiae after birth and the presence of this petechiae on this is the petechiae birth injury. Of course, the history was suggesting the petechiae as a birth injury more than other causes of petechiae. And the clinical picture in general, because petechiae due to thrombocytopenia may be due to neonatal sepsis, and the management will be different if this is due to neonatal sepsis. الصوت واضح ولا؟
هسه واضح دكتور احسن بس
يا شباب
نعم دكتور.
واحد يفتح المايك يجاوبني.
دكتور جاوبنا بس ما اعتقد تسمعنا.
دكتور ذاك السلايد راح ما سمعنا شيء منه.
دكتور تسمعنا؟
أتوقع الدكتور ما يسمعنا.
سمعت تسمعني؟
أنا أسمعك أحمد البديع، بس أتوقع الدكتور ما يسمعنا.
إيه.
هو طلع الدكتور اعتقد يرسل الانترنت.
نشوف ننتظر شوية ونشوف شو يصير.
شباب هسه الصوت شلونه؟
اي هسه رجع دكتور.
تمام دكتور.
لا واضح زين؟
اي نعم.
اوكي. رجعنا للسكرين شير طبعا. قلنا هذه شنو؟ شنو هذه؟
دكتور السكرين بعدي ما طالع يمكن.
ليش ما طالع؟
ماكو سكرين بعد امام شيره.
ماكو دكتور.
لحظة. من يفصل النت. هسه بدا مو؟
نعم.
اي دكتور طلعت.
يلا شنو هسه هذه؟ نشتغل عليه من كنا بدنا نحكي؟
البتيكيا.
بتنك.
اوكي. زين. Another slide, and how we answer it. It seems to be a neonate, and the shown part is the trunk and the upper limb. And we can see here this irregular area of patches of its color is irregular. It is of red or purple color on the trunk and on, here is on the trunk, and on the upper limb. So, presence of these patches, of course, in neonate indicate what? What we call this in Arabic. نسميها هاي بالعربي. باكر تقعد مقيم دوري.
كدمات دكتور؟
نسميها كدمات من نشوف يعني معناتها subcutaneous bleeding. نسميها كدمات وسحجات. نصح لها كدمات وسحجات. نسيت تكتب تقرير بالطب العدلي. تقرير الطب الأولي. In English, of course, this is ecchymosis and bruises or ecchymosis and bruising. Ecchymosis and bruising is another type of soft tissue injury, and of course it is the result of a traumatic traumatic delivery, and we can see it more in breech deliveries. We can see the ecchymosis, and as I said, it is a subcutaneous, and bruising. We can see it more in a preterm babies than baby because of the fragility of the blood vessels. So it is more susceptible to be bleeding. And presence of ecchymosis and bruising itself, it is not significant, and it takes time to resolve within the first few days of life. But we should be sure this ecchymosis and bruising is only reflecting subcutaneous hemorrhage. It is not associated with internal bleeding. So baby with ecchymosis and bruising should be examined if he has internal bleeding, like visceral bleeding, which is rarely to see in trauma of the or birth injuries. The other significance of the ecchymosis and the bruising, it is a sort of extravascular hemorrhage, or we can call it concealed hemorrhage. So this collected blood, when it will be reabsorbed, of course it will be hemolyzed, and it will increase the level of bilirubin in the body. So it may exacerbate for the neonatal hyperbilirubinemia. And babies with ecchymosis and bruising should be monitored for development of neonatal jaundice. This is the only notes about the ecchymosis and bruising. We can see here this neonate again. He has this bruising on the chest. If you see here, the bluish discoloration on the chest. And this bruising is not happened because of the traumatic bleeding. This is happened during the excessive neonatal resuscitation of this baby because he underwent a chest compression and positive pressure ventilation, leading to this bruising on his chest. And you can see here, this baby, his nose is linked with CPAP, so he is a critical baby. This is just an example of the ecchymosis or bruising or trauma that can happen for the baby even after birth when we do neonatal resuscitation, vigorous neonatal resuscitation for those critical and high-risk babies. Here, the slide of a face of the baby, and you can see here, if you go for the first side, you say this baby has a central cyanosis because of the bluish discoloration on his face. But this is wrong, because if you go second time for the picture, and if you see the line of the demarcation. نعم؟
عندك شنو دكتور ما سمعنا؟
منو هذا العدل؟ بعدني ما كملت السلايد. If you notice here, there is a demarcation between the upper and lower part of the face. And you can see here is a swelling on the face, the distortion of the face. The swelling is especially on the eyes. So this is not a cyanosis. This is a case of face presentation. When the face is the presenting part and it comes against the birth canal or the pelvic bone of the mother, it leads to swelling, distortion, and the bluish discoloration. And this is because of ecchymosis and bruising, and it will take time to resolve. How we know this baby is not having cyanosis? Of course, by the examination of his mouth and his tongue, and of course by the examination of other parts of his body. Because when the baby is deeply cyanosed to this degree, it's supposed to be a bluish discoloration on whole body, not just the face. And of course, the history is very important if we know this is a face presentation. Another picture of the face presentation, and this is more clear than the previous. You can see the bluish discoloration on the upper two-thirds of the face, and the lower one is pink. And you can see here the swelling of this eye, because this is the more presenting in the face presentation, and the normal color of the lips. So this is another example of face presentation. We will do nothing for this baby, just waiting for the edema to resolve, and the color will change to normal. What we can see here, of course, this is a back of neonate. This is a back of a neonate, and we can see here there is a well-demarcated area of erythema. It is red color, purple color. It is well demarcated, presenting on the back. And if we take a history of this baby, we can know this baby is a post-term baby, and we can know this is a subcutaneous fat necrosis. Subcutaneous fat necrosis, it is a type of birth injury, of soft tissue injury that happened because of the focal pressure and ischemia of the adipose tissue, of course, of the subcutaneous tissue during the birth process. So it is mainly affecting the back of the baby. May affect other part, but mainly on the back. As I said, it is a well-demarcated, well-described, and it is surrounded by erythema. That's why this is a red color, and sometimes maybe also a purple or blue. Subcutaneous fat necrosis, also it will resolve spontaneously, but it takes time, longer than other soft tissue injuries. It may reach to 6 or 8 weeks. And doing nothing with it resolves spontaneously. But the significance of this is the development of hypercalcemia during the resolution of this problem, because this is a necrotic tissue and there will be lysis of its content. So there will be leading to release of calcium to the circulation, so it may develop hypercalcemia. This is the only significance of the development of subcutaneous fat necrosis. This is a simple example of subcutaneous fat necrosis. I will show you now this one. This is, there is a patches, there is a nodular or a glandular tissue. You can see here, because of a severe subcutaneous fat necrosis involving not just the back, of course, a whole back, the neck, and even the upper arm, or the upper limb. So this is a severe form of subcutaneous fat necrosis. Again, it needs nothing to do with it. Just waiting for the resolution. And of course, for this baby, we should monitor the serum calcium, because we expect the release of more calcium to the circulation while the lesion is resolved. This is a neonate having the redness, scratch on his face, on his forehead. Of course, this is not as spontaneous by scratching his forehead with a fingernail. This has happened due to application of the scalpel use that can be happened in vaginal delivery or in cesarean section. This is, of course, a traumatic. May be found on the face or may be found on the thigh, on the gluteal region. This is simple, most of cases, and need nothing just to care or monitor, but sometimes it is a deep incision, bleed, or laceration. This is, of course, called lacerations, so need to be sutured in some cases. Now we will leave the soft tissue injury and going to the extracranial injuries. And firstly, before going to the injuries or the trauma, we will comment on this slide, because you can see here the abnormality of the shape of this baby. There is elongation of the face and the projection of the this part of the face. Of course, this is abnormal, and this is because of the molding of the skull that happened normally, spontaneously during the passage of the face through the birth canal, and just a few hours or in just a few days of life, it will regain a normal shape of the head. And sometimes it is maybe causing frustration for the family, because they think the baby will continue his life with this abnormal shape of the head. But we just reassure them, because this is a normal. So you can see here the fetal molding, why it happened and how it happened, the difference between the normal color structure or the normal shape of the skull and after molding. So as it will also be after the 24-hour, it regained the normal shape and even the size of the head after resolution of the molding. Sometimes the molding lead to overriding of the suture. So when we palpate the head of the baby, we found some suture is coming over the other. And of course, this will disappear when the shape of the head return to normal, when the bone return to take the normal relation with the adjacent bone. So it will be normal suture. This is another example of excessive molding. It is very clear here. And even this can happen in every neonate, not just the public. So even the Prince George, I think his name is George, the first son of the Kate Middleton and the Prince William, has a molding in the just a few hours of life. This is after discharge. He was a well baby. So discharged home at just a few hours after delivery. You said the baby must be kept in the hospital for up to 48 hours. Of course, for this royal family, they will go to the Buckingham Palace, and there's a team of doctors will follow the state if he need to be monitored or followed or interfere accordingly. But in general, what happened in the hospitals, it at least keeping the baby for 24 hours. So we go to other slide and the abnormality here. Of course, this is a neonate. Of course, you will go to this depression on the side of his skull. This is because of pinching, so there is a depression. So
No, there
what is? Sorry?
I said there is another sign.
What is the other sign?
It's Caput Succedaneum.
هذه الأذر sign. والفirst sign شنو؟
I don't know, sorry.
This depression on the skull is because of
Edema?
swelling. Please don't comment. I say there is no time, so just listen to me. Unless I ask you to answer. So, because this is depressing swelling, of course it may be or it should be due to edema, pitting edema. So, presence of edema on the skull of the neonate that happened immediately after birth, this is called a Caput Succedaneum, which is called the serosanguinous edema, happened within the skull because of the pressure of the presenting part against the pelvic bone. It is edema, appear immediately after birth, and the edema may be small, may be limited to one area of the skull, or it may be huge and extended all over the skull. This is edema, so it will resolve in just a few days of life, just making the shape of the head abnormal, but it is nothing to do. Sometimes it is like this, the skin color and shape is normal, but sometimes it may be a hemorrhagic Caput Succedaneum causing or comes with ecchymosis with abrasion or bruising on the skin. The significance of the Caput Succedaneum, it may contain blood when it's becoming hemorrhagic, so it may need blood transfusion if the bleeding is huge, or of course it may increase the level of the bilirubin, leading to development of neonatal jaundice. What we should do is to differentiate the swelling of the head of the baby, because we have more than one type. Like this. Here is again a swelling, but it is localized to one part or one area of the forehead, of the head. And if we come to the specific site, we can see it on the parietal bone, and it didn't cross the midline, so it didn't cross the suture line. If we palpate this swelling, we will find it is fluctuating, and if we follow the history of the development of this swelling, we found it developed few hours after birth, not immediately after birth, and it is increasing in size. So all these indicates because of this swelling, it is hemorrhagic. And when the hemorrhagic swelling found in the head of the baby, this is called cephalohematoma. Cephalohematoma, it is a subperiosteal bleeding, so that's why it is limited by suture line, because it is limited by the bone, subperiosteal. and it didn't cross the midline like what happened in Caput Succedaneum. It appears few hours after birth because it is a blood collection, so need time to be collected. By palpation, it is fluctuated because it is a bleeding, it is not an edema, it is a hematoma. And if we ask about the management, most of the cases need nothing to do. It will resolve spontaneously, take 3 to 4 weeks. But this is one of the risk factors to develop neonatal jaundice, because this is a concealed hemorrhage, extravascular bleeding. It leads to elevation of the total serum bilirubin. So, how we diagnose it? Of course, the diagnosis is by the history, is important, physical examination, and sometimes we may need to do imaging, maybe the X-ray or the ultrasound, to go to the specific diagnosis of the hematoma. And cephalohematoma can happen in term, preterm baby, and it can happen in all types of delivery, so vaginal or cesarean section. This is another slide of cephalohematoma. This is a baby comes to me, and you can see here there is a rectangular shape of the head, and this is because of this baby has a bilateral cephalohematoma, so causing projections or protrusion or swelling on the both parietal bones, but because both cephalohematoma didn't cross the suture line, so there will be an aberrant depression given the shape of his head. This is from the side for the same baby. This is one of the cephalohematoma, appears as swelling or bulging on one side of the head. And this is more clear to show that this baby has a bilateral cephalohematoma. This is one, and this is the another, and it's because it didn't cross the suture line, so that's why it appears as depressed. Because this is a cerebroosseal bleeding connected to bone. It didn't cross the suture line. Now, we have another type of head swelling, of extracranial, of course, given abnormality of the shape and the size of the baby. And this is a part of the neonatal examination. inshallah القادم راح ناخذ section of neonatal examination. Or Caput Succedaneum. The suspicion goes to be it is a Caput Succedaneum because it is a huge swelling and it crossed the suture line. It may involve all the skull, but by examination, by palpation, it is fluctuating, and by the development, follow-up of the development, so not appear. And this is of a risky type of extracranial scalp swelling. This is called the Subgaleal Hemorrhage. The Gallia pneumatica or pneumosis. So it is not limited by the suture line. It is according to the size. It may be localized or it may be diffuse. So if it is diffuse, it is risky. Why? Because the bleeding here is not localized like what happened in the cephalohematoma, and it may lead to collection of about 40% of the blood in this open space. And of course, this will lead to hemorrhagic shock. So we should follow the baby with subgaleal hematoma to development of the shock, because we have a triad of the clinical finding like the tachycardia, falling in the PCV because of the bleeding, ongoing bleeding, and increasing in the OFC. This may develop in just the first 48 hours of life. And we should follow those babies, and sometimes we need to treat them with evacuation of the hematoma if it is very severe, or cauterization of the bleeding vessels if it is ongoing bleeding. But of course, if it causes anemia because of loss of blood, we should treat it with transfusion of blood, and of course of whole blood, because this is hemorrhagic, not by packed RBC. Now we will go deeply to the cranial injuries. This is a teaching slide pointing the black arrow to this shadow on the skull bone on the parietal, and of course this is a linear fracture. Linear fracture or linear skull fracture, it most commonly or usually happen on the parietal bone, and it is because of the application of forceps. And most of the cases, the only follow-up or the only intervention with this type of skull fracture is by follow-up and evaluation. Need nothing to do. What is significant, what's serious, is the depressed fracture of the skull bone. You can see here the depression. This is an area, or this is a part of the cranium of the parietal bone is depressed, again because of using of the forceps delivery, and it is risky, it is significant because it may increase the possibility of intracranial problem, especially if the size of the depressed fracture is more than 1 cm. And sometimes it may be associated with a neurological deficit in form of hemiparesis, hemiplegia, or even development of seizure. Sometimes this type of fracture needs to be managed surgically. And the indication for the surgical management of this type of a fracture is when there is a bony fragment, presence of bony fragment within the cerebrum, so it should be removed, or presence of neurologic deficit, or there is a presence of CSF just beneath the gallia, I mean above the bone, of course, and beneath the gallia, it means under the skull. And if there is no response to the close manipulation or the conservative management, it should be managed surgically. This is another slide of the depressed fracture, how it appears on the skull X-ray and how it appears grossly. This is another slide of depressed fracture, and of course on the parietal bone. Now we go more deep to the intracranial injuries, and of course it is the bleeding. We will talk about we have more than one type of the intracranial bleeding, and we will talk about this because it is the most common intracranial hemorrhage and can happen in term newborn, which is the subdural hemorrhage. So you can see here, this is a huge hematoma found subdurally and leading to the pressure and the pressure effect on the cerebrum, and it affects on the ventricular system and even on the other parts of the brain. This is a severe subdural hematoma. It can happen because of the use of the vacuum or forceps delivery. And as I said, it happened in term babies, but it can happen also in preterm baby. And some of the cases, it will resolve spontaneously, or sorry, most of the cases. and the close observation without surgical intervention. But if it is severe or showing signs of increased intracranial pressure like this, it needs to be evacuated. It needs to be surgically evacuated. Now, this is another type of the intracranial bleeding, and here is, of course, it is intraventricular hemorrhage. You can see here, this is the ventricles. It is filled with blood. This is hyperintense, showing a hyperintense. This is a CT scan, and also both types. So the intraventricular bleeding, it is more common in a preterm baby because it may be due to the immature or premature the cerebral vasculature, making the preterm baby more susceptible to develop the intraventricular bleeding. Now, this is another type of the birth injuries, and in this slide we can see the redness here. This is called the subconjunctival hemorrhage, and we can see the dots here, the right, so the red dots posed on the forehead. The same cause for this abnormality. This is called the subconjunctival hemorrhage because of the precipitous delivery or the nocal cord causing this bleeding. Can happen subconjunctively or can happen subcutaneously. This is resolved spontaneously. Now this baby, his age is 1 month, so he passed the neonatal period, but he has abnormality. Anyone can tell me what is the abnormality in this baby?
Muscular torticollis.
Oh, because you have the side file. Okay. If you say there is abnormal tilting of the head, this is better for you. Yes. This baby has abnormal tilting of the head. So, for you, where is the lesion? It is on the right side or on the left side? انت ما دام عرفت هذا muscular torticollis.
To the left side, the effect side.
Left side. How do you know? Why you say this is the left side muscular torticollis? Why it is not the right?
Tilted toward the affected side and to the sternocleidomastoid, the same side, and the chin is pulled away from that side.
Yes, right. This is a right side congenital muscular torticollis, shortening of the body of the sternocleidomastoid on this side. That is the head is tilted toward. So this is on the left side, shortening, causing the head tilted. But of course the face will go to the contralateral side and the chin will be elevated. So this is a left side muscular torticollis. This will show how it appears. This is a shortened or contracted muscle, maybe due to hematoma or maybe due to a torsion of the muscle, and causing the head tilted toward the affected muscle, and as I said, the chin will point away from the contracted muscle. The congenital torticollis, it is in most of the cases will resolve spontaneously, but sometimes it needs to be monitored to doing the massage or stretching of the muscles to elongate it, and sometimes if we have need to be managed surgically, in some of the cases, need to be managed surgically to correct the shortened muscle. Of course, the presence of the torticollis takes time, but sometimes it may appear since the birth. So during examination of the neck of the neonate, we should examine the sternocleidomastoid for the presence of the swelling. As I said, it may be due to hematoma or it may be due to torsion of the muscle fibers. Here is a baby with abnormal face, closing his right eye. What does this baby have?
دكتور facial nerve paralysis.
On which side?
On the left side, doctor. Unable to close his eye, plus remote deviated to the other side.
Very good. This is a left side. Of course, this is wrong. This is not a right side. This is a left side facial palsy. Because in facial palsy, the face is deviated to the normal side, not to the other. Here is the absence of the angle of the mouth, orbicularis oris muscle, and the orbicularis oculi muscle, so he cannot close his eyes on the affected side, and there is a deviation of the mouth with it rolling during the feeding. This will be more clear if the baby is crying, but for this baby is clear even without crying. Facial palsy happened due to the pressure effect or injury to the facial nerve on the track of the facial nerve. It is a lower motor neuron, so that's why it involves the upper and lower part of the face, because this is pressure or compression on the peripheral fiber or branches of the facial bone, and of course because of forceps delivery. You know, the forceps delivery is a major risk factor for most of the birth trauma. And what happened for those babies, it should be managed conservatively by putting an eye patch or something to close the eye, because he cannot close the eye spontaneously, and given an artificial tear to prevent the corneal injury. And sometimes the facial injury needs to be surgically repaired by neurosurgery if there is no resolution during the first year of life. But most of the cases, it will resolve before this time. So, what is abnormality in this baby? This is the same baby with different pictures, different movement, but something is fixed with this baby. What is it? No answer?
Unable to move his left hand.
عافية سميح، ما بتعرف diagnosis، سوالنا comment، سوالنا يعني description of the slide and analysis. So he is unable to move his left upper limb while he is moving the right freely. So what is the cause of, or what is the condition making the baby cannot move his arm bilaterally at the same time? Of course, this is because of a nerve injury that's called the Erythema Palsy. Erythema Palsy, it is the most common pattern of the brachial plexus injuries. It involves the C5, C6 cervical nerve, and as I said, it is the most common. And it can happen because of the breech representation, or again the gentle traction of the baby causing the injury to the brachial plexus. So most of the cases, the problem is just a pressure, a trivial pressure on the brachial plexus, so it will resolve within the first 24 hours of birth or just a few days. But sometimes there is a real injury to the nerve and need time, or sometimes it may be permanent lesion. The examination, the reflex that be examined to diagnose or to clarify the presence of Duchenne palsy is the molar reflex, because the molar reflex will be unilateral, because the biceps reflex on the affected site will be lost. This is C5, C6. So what is the usual presentation of this baby. As you see here, there will be, starting from the shoulder, there will be adduction. He cannot abduct. Internal rotation, this is on the shoulder. Extension of the elbow. Going to the forearm, there will be pronation. There will be pronation. And going to the fingers, there will be flexion of the fingers, the long flexors of the. So, this gives the shape of what is called the waiter tip deformity. تعرفون شنو الwaiter tip deformity؟ شو يقصدون بها؟
دكتور يد النادل أو يد الأعبد.
يد النادل، يد النادل.
دكتور راح الصوت إذا موجود اسمعني.
أتوقع الدكتور طلع من الميتينج.
إي هسه يرجع.
أهم النت ومشاكله. كنا منفصلين عنكم احنا.
إي دكتور وصلنا ليد النادل.
يد النادل، إلى يد النادل وصلنا. جيد. عرفنا هسه يد النادل مو؟
نعم.
يعني هسه إذا تروح بمطعم يا أحمد في الدولة العربية لازم تحضر بخشيش مالتك، سواء أنت طلب $10 لو $500، لازم تحضر البخشيش مالتك لا يحجون عليك. زين؟
تمام.
كذا الويتر تب ديفورميتي حكينا عليها، الاوت كم حكينا عليه، سمعتوا ولا لا؟ outcome ranging from 0 to 90. Why this abnormal wide range of outcome? Because this is depending on the extent of the nerve injury. If it is just a pressure on the nerve, edema take time to resolve, ممكن خلال 24 hour resolve. But if it is a real intersection or transection of the nerve root نفسه, راح يسوي لي permanent lesion, اللي هو قلنا بالكبر ممكن تشوفون الناس بالحياة إيده عضبة يصيحوا لها أعضب. السبب هو ال position palsy. Because of the they didn't use the affected hand, the affected upper limb, راح يصير عنده disuse atrophy, فراح يصير حتى عنده اكو atrophy and inequality of the size of both upper limbs. هسه احنا another type of or another form of the brachial plexus injury. سحولة شو يسموه هذا؟ انقطع الاتصال؟
اي نعم دكتور، ده قطع. تسمعني دكتور؟
شباب تسمعون؟
دكتور قطع.
رجع الصوت.
يلا شنو هذا هسه تشوفون؟ خلي يحكي عن
دكتور يعني شلون لك لو هاند شيء
T8T1. So the biceps movement is intact. The biceps reflex is intact. As you see here, he can flex the elbow, but he can extend the muscle of the arms. So the lesion is in the long flexor of the arm, causing the flexion of the fingers. And you can see here the wasting of the intrinsic muscle, yes, or the intrinsic muscle of the hand because of the disuse atrophy. نجد نشوف X-ray. One of them is normal and the other is abnormal. وين هالnormal وين هالabnormal؟
دكتور left side abnormal.
Left side abnormal. Why?
دكتور الفرينك or الدايفراماتيك diaphragm بالleft side يعني بالرايت side مال left X-ray is elevated. الو
ترى ما قاعد نسمع، قطع كلش.
دكتور ماكو صوت يمي.
Then this is pathologic. This is abnormal, and this is because of the paralysis of the right dome of the diaphragm, because of the paralysis of the phrenic nerve.
دكتور
نعم.
هذا سلايد ما سمعنا كله كان يقطع.
وهسه
يلا اجى الصوت.
يلا ماشي تدلل. We can see the X-ray of this neonate. This is abnormal because there is an elevation of the right dome of diaphragm, if it compared with the left side, more than 2 intercostal space or more than 2 ribs. This is abnormal. Normally there is elevation of the right dome of diaphragm because of presence of liver, but it should be not to this extent. If we found it like this, to intercostal space or more like this, this is mean there is a phrenic nerve paralysis, phrenic nerve palsy on that side, making the diaphragm is not functioning during the respiration. You know, the respiration, the role of the diaphragm is essential. The diaphragm and the intercostal muscles is essential in respiration. If there is paralysis, the chest movement will be impaired. ايش راح يصير عند هذا البيبي ما دام عنده paralysis of the phrenic nerve? Of course there will be a respiratory distress. راح يصير عنده respiratory distress. راح يصير عنده recurrent episodes of cyanosis. راح يصير عنده diminished breath sound on the affected side. بعد هو during respiration of a newborn زين شو راح يصير؟ المفروض يصير bulging of the abdomen، يصيحوا له abdominal thoracic breathing، لأنه بعده chest wall movement is not well in the baby، فراح يسوي pressure on the abdomen during inspiration، يسوي bulging of the abdomen. لأنه diaphragm on the right side is affected، the net result there will be no bulging of the abdomen on the right side or on the affected side. مثل هذا right side on the affected side. زين. Diagnosis نشوف signs of respiratory distress، ممكن نفكر هذا other causes of respiratory distress، لكن لازم ما ننسى the phrenic nerve injury. لما نشوف there is no bulging of the abdomen on the affected side during the inspiration. هاي وحدة. وباي exclusion of other causes. أكيد إحنا دازين البيبي for X-ray, chest X-ray. ما كان نشوفه RDS، نريد نشوفه هذا pneumonia, pleural effusion، نريد نشوف شنو الcause of this respiratory distress. فنتفاجأ بأنه نشوف lung field normal، لكن نلقى diaphragm is elevated more than 2 spaces. راح نعرف أنه diagnosis هو phrenic nerve injury. More precise diagnosis نسوي ultrasonography or fluoroscopy, digital fluoroscopy، راح تراوينا البارادوكسيكال diaphragmatic movement during inspiration. ما راح نشوف movement of the diaphragm during inspiration. The treatment of course هذا البيبي ايش عنده respiratory distress، فيحتاج a supportive management accordingly. definitive treatment يسموها surgical application، اللي هي نخلي diaphragmatic pacing. شلون بنخلي pace maker للهارت اللي عندهم هارت بلوك؟ زين احنا شو نسوي؟ نحط pacing on the diaphragm in humerus ورarely to happen as a birth trauma، لكن it may be happened ويحتاج management. أكيد يحتاج له reduction، ممكن close reduction يحتاج. جيد. إذا صوت أكو جيد يقطع شو نسوي؟ اليوم النت ضعيف.
لا دكتور موجود استاذ طارق.
اوكي هذا اللي نشوفه هنا شنو؟ هذا اللي تشوفوه هنا شنو؟ من يا بطل يعرف؟
تركوا إدمة يعني
وينها الإدمة؟
يعني على منطقة النك.
وين وش تايب اوف ذا هاي يعني سنترال هاي هنا؟
لا بالبيز
هنا؟
واكو بروزنج تفرجوا شلون صاير زراق على جهة الليفت.
هذا اللي تشوفوه هنا هو clavicle fracture. هذا clavicle fracture. Of course, which side? Of course, the left side. هذا هو most frequently fractured bone during birth هو clavicle fracture because of the dystocia. البيج بيبي هذا big baby ممكن يكون الانسترومنتال ديليفري كذلك سبب لنا اياها، ممكن يكون prolonged a second stage of labor. فهو الكومنست بون fracture هو fracture clavicle. الدايجنوز ايش راح يصير؟ زين؟ من نجي نفحص احنا حتى هاي بالنيوناتال اكزامينيشن راح نسوي palpation on the chest. نبدا من الكلافيكل and going downward. راح نشوف اكو تكتايل كريبيتس، يعني من نجي نفحص راح نسمع طقطقه كريبيتس. ممكن نشوف باتيكي او ممكن نشوف حتى كيموسس سايد مثل هذه on the affected side. وبعد شو راح نلقى كذلك اذا نجي نباوع نلقى اكو فد elevation swelling، ونلقى الشولدر، نلقى الشولدر on the side ايش بيه يصير shorter or lower than the shoulder of the normal side. هذا اللي نلقاه بالفراكشر كلافيكل. عادة there is no specific treatment، وجست انه اذا كانت painful طبعا avoid the gentle movements of the baby، وممكن انه نضيف something to relieve the pain until the callus formed. هذه هو الفراكشر كلافيكل. هسه احنا طلعنا من النيرف او البيرث انجريز بيرث تراما، راح نروح على normal findings can be seen in the baby، وهاي راح نحكي عليها اكثر in details in the examination. بس من راح تشوفون السلايد راح تفهمون السيشن اوف examination شنو اللي نقصده. هاي اللي تشوفوها whitish greasy material covering the skin of the baby. وايضا ممكن نشوف قلنا احنا السلايد نقراه راح نشوف البلوش discoloration of the lower limb. فاذا واحد سالنا what are findings on this slide راح نقول له bluish discoloration. هذا على الاقل acrocyanosis or peripheral cyanosis like we didn't see other part of the body, and the whitish greasy material on the skin اللي نسميها vernix caseosa. This is lining the or this is covering the skin of the baby. وبعدين post term baby preterm baby ما موجوده، لكن during the term period it start to appear. طبعا baby after delivery with this material should remove على مود نمنع لان هذه راح ممكن نسوي عندي hypothermia because it lets the baby wet. هذا other vernix caseosa هنا very severe involving holding baby هنا pinkish crying normal color زين، بس عنده vernix caseosa. هاي اللي نشوفها هنا شنو هذه؟ هاي مو فيرنكس كازيوزا او فيرنكس كازيوزا، لكن الكلر مالتها ايش صاير بيه؟ هي فيرنكس كازيوزا، الكلر مالتها صاير جرينش يلوش جرينش. السبب شنو هنا؟ من يعرف؟
صاير بيه ميكونيوم.
ميكونيوم عافيه، because of ميكونيوم زين، فصاير بيه ميكونيوم ستينينج. اذا الميكونيوم ستينينج ممكن involving the vernix caseosa كانت لونها وايت صارت يلو جرين. اللي نشوفه انا عند this slide هذا البيبي crying and he is pinkish, his skin, his mouth and tongue، لكن نشوف عنده bluish discoloration of the hand. This is called the peripheral cyanosis or acrocyanosis. هذا ممكن يحصل بالcold injury like normal vasoconstriction, peripheral vasoconstrictions، وممكن after time it resolve. حتى إذا استمرت more than one day it is not significant. This is another picture of the acrocyanosis. ممكن نشوف the other part of the body looks pinkish while the soles are blue. This picture is to compare between the central or the whole cyanosis, whole body cyanosis, and just the acrocyanosis. هنا البودي كله صاير blue while here just the upper and lower limbs. فقط الhands، شوف عبالك لابس gloves. Just the hands and the feet. هذا الناس تشوفوا يلا من يقول لي هذا ايش بيه؟
دكتور العفو، اللي على الرايت سنترال ساينوسيس والليفت اكرو ساينوسيس.
لا عبرنا هذا السلايد، احنا على الورا. شوف السلايد اللي ورا.
دكتور سلايد واقف بعده ما هذا.
دكتور بيرث اسفكسيا.
وشلون عرفت بيرث اسفكسيا؟ هلا راح نعبر، خاف ما متحرك عند الكل. شلون عرفت بيرث اسفكسيا هذا؟
دكتور
نوصل بيرث اسفكسيا
بي في وتي تيوب ولا
يعني بس ذولا بس البيرث اسفكسيا يكون هذا الشيء؟
يعني دكتور خمنت.
بالطب ما عندنا تخمين، زين؟ بالطب ماكو تخمين، انت عشان هسه المفروض تسوي description of this slide. هذا نيونيت ايش بيه؟ هسه اكو عندنا فايندينج. اول شيء اذا تشرح الاكسسوارز اكو عندنا ذني شو نصيح لهن؟ ذني الالكترودز اوف مونيتورنج، هاي اللي تشوفون هنا. اكو عندي كانيولا، اكو بلو اي بي لاين، اكو عندي هنا هذا اليلو. بعد اكو endotracheal tube connected to ventilator، هاي لازم تذكرها. زين هذا يا بيبي اللي واصل مرحله انه assisted ventilation endotracheal tube وحاطيه على مونيتور وتو اي بي لاينز. زين هذا معناته ريسكي بيبي. بعد نجي الى البوستشر اوف ذس بيبي. ايش بيسه هذا البيبي؟ شو نقول عليه؟ هو اول شيء سليبي، ممكن يكون يعني سليبي، ممكن يكون انكونشس اللي هو كلوزنج جاز، ممكن يكون انكونشس بس احنا ما نعرف. انا مو نقول انكونشس لازم نشوف الجلاسكو كوما سكيل مالته، ما نقدر اي واحد نايم نقول عنه انكونشس. لكن ايش عندنا بعد فد البوستر مالته ايش بيها؟ يلا يا بطل يقول لي.
دكتور فلوبي.
فلوبي انا سالت على البوستر ما سالت على الكلر. البوستر فلوبي. ليش؟ البيبي normally should flex all his joints حتى اذا كان سليبي. تلقاه مسوي فليكشن كل الجوينتس مالته و bilaterally at the same time. زين هذا ايش مسوي لنا هنا؟ extension of the upper limb وحتى extension or mild deflection of the lower. فلوبي بيبي. زين فلوبي بيبي ممكن يكون unconscious وريسكي. الكلر مالته هسه شنو؟ سوي comparison between the color of this baby and the hand of this nurse. هنلقاها pale. هذا not just blue، هذا pale. يعني لما يصير severe cyanosis يسوي لي pallor. يقدر يقول لي cause of pallor شنو السبب؟ مثلا انيميا، blood loss صاير عنده، لا other cause يسوي لي pallor in this high risk baby. ليش صار pale؟ يصير pale لانه اكو decreased tissue perfusion. مدى يوصل blood supply enough to the subcutaneous tissue and to the skin. فيسوي decreased tissue perfusion. سوت هاي البالر. وين نلقاها هذه عادة؟ من يصير decreased tissue perfusion يا اما بالشوك، شوك ستيت طبعا، وممكن يكون hemorrhagic shock، ممكن يكون septic shock، ممكن يكون other type of shock. لكن هو شنو اللي خلى البيبي يوصل الى مرحله الشوك؟ هذا اللي حاطين له تيوب وصاير فلوبي. هذا عنده اسيدوسز. عنده اسيدوسز. الاسيدوسز همين نسوي decreased tissue perfusion نسوي لي بالر. ليش هذا البيبي صار عنده اسيدوسز؟ هسه نرجع السميح. سميح
بلي دكتور اسمعك.
ليش صار عنده اسيدوسس هذا البيبي؟
يعني ممكن الاسفاكسيا
حاكيه. هسه تقول اسفكسيا، هسه تقدر تقول بيرث اسفكسيا، مو تروح لها قبل؟ زين؟ مو تروح قبل تقول بيرث اسفكسيا؟ يلا هذا البيبي ايش عنده؟ احنا بدنا ناخذ هسه الكلر تشينجز. اذا اول نقطه لازم نسويها بالاكزامينيشن اوف ذا بيبي هي نباوع his skin. look at his skin abnormalities. بدينا بالفيرنكس كازيوزا لان هاي abnormal thing found، يعني احنا بالنسبه لنا abnormal بس هو normal finding of the neonate. ونباوع على الكلر تشينجز. بدينا بالساينوسس كلر. هسه هذا الطفل ايش عنده؟ بس هذا مبين
yellowish discoloration دكتور.
Yes, this is yellowish discoloration. إذا نباوع عليها نلقاها more on the face and the upper chest more than the lower lip. وهو هذا النورمال distribution of neonate. يبدأ cephalocaudal، يبدأ من الهيد وينزل لي جوا. شلون نعرف؟ أول شيء مبين هو يلو. احنا حاطين على نون يلو باك جراوند. هذا حاطين هنا السينك أبيض و compare it with the color of the skin of this nurse. فهذا عنده جوندس. والبيبي طبعا هو الرت وفيجورس وكنه ورده. زين. هذول ايش عندهم هنا؟ بيبي 1 بيبي 2. Of course there is difference between the color. One of them is plethoric and the other is pale. هذا البليثوريك او نصح له dusky color هذا مو ساينوسس، هاي بليثورا. هذا because of polycythemia. and the pale هنا هاي البالر. شوف هاي البالر هنا مو ليش البالر due to cyanosis or due to acidosis. شوف هنا pinkish البيبي لكن هو pale. هذا anemic baby. This is called the recipient and this is the donor. And this condition called the twin-to-twin transfusion syndrome. This happened in monochorionic baby. The monochorionic baby يعني يتغذون on the same placenta. One of them receive more blood than the other, so it become larger in size and become plethoric. يصحوا له donor recipient and the other called the donor. Other picture of the twin-to-twin transfusion وتشوفون أيضا الcolor change and even the side. يعني شوية الرايت سايد او الليفت سايد يبين، يعني الليفت سايد اوف ذا بيكتشر قصدي يبين مور يعني اكثر. زين هنا هم واضح عندنا الديفرنس ان ذا سايز and difference in the color. هذا شويه يعني plethoric more than this baby. زين اكو فد سلايد كلر difference لكن السايز اوف كورس لا مبين. هذا is bigger than the other. هذا تشوفوه هنا two findings هنا. من يقدر يعرفها؟ يلا يا شباب.
اكو شلون الفيشرنج بالسكين يعني سمول
فيشرنج اوف سكين. فيري جود فيشرنج اوف سكين. وبعد شنو بدنا نشوف؟
greenish discoloration of the umbilicus.
greenish discoloration of the umbilical stem هاي بدنا نشوفها. والفيشرنج اوف ذا سكين. هذا المهم عندنا احنا هنا مو الجرينش كلر. المهم عندنا هو الرينكلد سكين اللي تشوفوا الفيشرنج والبيلنج اللي سميناه فيشرنج. وهذه ساينز اوف بوست ماتشوريتي. بيبي بوست ماتشور راح نلقى السكين مالته لايك اولد مان. نلقاه صاير بي رينكلينج او رينكلد، نلقى بي فيشرنج اور بيلنج. هاي ساينز اوف بوست ماتشوريتي. بعد شو نشوف عندهم؟ هاي نلقاها اكثر وين نشوفها؟ نلقاها بالسولز اند ان ذا بالمز. ونشوف بعد elongation of the fingernails. هذه وحده of the signs of the post maturity. هاي اللي قاعد نشوفها. هذا peeling of skin, wrinkling and شوفوا fingernails. All are signs of post maturity. هذه normal. بعد abnormality or something to be examined. يعني من نبدأ الاكزامينيشن خلصنا هسه السكين الكولر نجي إلى presence of a swelling. This baby has a generalized swelling. طبعا هذا stillborn baby. شوفوا حاطي beside the tape على مود يراونا السايز مالته. نشوف السايز مالته هذا شقد البيبي. هذا تشوفون abdominal distension عنده. الفيس also swelling. زين swelling of the genitalia of the limbs. This is because of hydrops fetalis. This is the diagnosis of this baby is hydrops fetalis. Hydrops fetalis have many causes. It may be classified better to immune and non-immune. The immune is like the RH isoimmunization. RH isoimmunization أو RH sensitization. شو تسوي لي؟ تسوي لي intrauterine hemolysis، وبالنتيجة هاي الهيموليسيس راح تسوي لي severe anemia causing congestive heart failure. Congestive heart failure يسوي لي pleural effusion, pericardial effusion, ascites، وتسوي لي هذه الأديمة اللي تشوفوها. والبيبي ممكن يجي alive or ممكن يجي stillborn ويصير عنده hydrops fetalis أو يصير له erythroblastosis fetalis in this type. أكو non-immune type يعني ما له علاقة بالإميون، ماكو فد هيموليسيس، بس نفس المشكلة عندنا congestive heart failure. مثل منو؟ مثل congenital infection. Which congenital infection causing hydrops fetalis?
دكتور سعد دكتور
One of the
CMV دكتور فيروس سايتوميجالو فيروس.
لا ما يسبب لا ما تسبب. شنو هاي وين رايح التوكسوبلازموسيس؟ زين اقول لكم انتم تدرون بنهاية الكورس مالتكم لو ما تدرون، وتدرون من تختمون الاطفال تروحون على الكورس القادم بعد ما لكم علاقه بالاطفال من امتحان فاينل يا معودين. زين المفروض هسه نسمع اجوبه مو مثل ما كنا نسمعها بدايه الكورس، تمام لو لا؟ منو قال بارفوبي فيروس 19؟ ها؟ منو قال؟ ليش يتراجع؟ يلا اثبت على قولك.
نعم دكتور. فيروس
فيروس بي 19 هو التورش انفكشن كوزنج هيموليسيس، يسوي لي هيموليسيس بس نوت اميون هيموليسيس ويؤدي لي الى نفس السيكولي هذه congestive heart failure. بعد other causes of هي طبعا كل list of causes طويله بس هاي انتم اذا تعرفوها enough. غير البارفوبي فيروس 19 والار اتش ايزوامينايزيشن عندنا الاس في تي congenital SVT. congenital SVT يسوي لي congestive heart failure وينتهي بنفس الشيء، وممكن يكون also الcongenital nephrotic syndrome هم تسبب لنا swelling ويسبب لنا hydrops. هسه هذا stillborn baby، هذا alive baby عندنا بالان ICU مالتنا. هذا عنده تورش انفكشن، عنده بارفوبي فيروس 19، سوينا له تورش سكرين وطلع بوزيتيف 4 يعني فور هز مدر طبعا سوينا له وهو هم دزيناه. تشوفون هذا البيبي عنده هيوج اسايتس واكو عنده هذه السوبرفيشال فين دايليتيشن. طبعا هو عنده ريسبيرتوري ديستريس لان اكيد هذا الهيوج اسايتس افكت ذا ريسبيريشن، ما عنده هو بلورال افيوجن فاحنا خليه على سي باب. بعدين يعني انفورشنتلي ذا بيبي باس اواي. هذا اللي نشوفه هنا، شوفوا الاسايتس، شوفوا الابدومينال ديستنشن، شوفوا البلجينج اوف ذا ابدومين ان كومباريزون تو ذا تشيست. بعد عندنا مور ذان ون بيكتشر فور هيم. تراوينا شوفوا هاي عنده بيتيكي وسوبرفيشال دايليتيشن واضح هنا، حتى هنا عنده ساينوسس. وهذا عنده شنو حاطي له ان جي او او جي، وش ذا يطلع هذا الاو جي؟ من يعرف شنو هذا؟ اللي نشوف هسه هاي الاو جي، خاف ما حد شايفه. هاي الاو جي حاطيها او جي يعني اورو جاستريك، ما حاطيها بالنوز لان النوز بيزي وذ ذا سي باب. فهذه الاو جي طلعيها من هنا راح الاستمك طبعا طالعه من هنا مربوطه تو ذس باج. ايش بيها هاي هسه؟ شو نسميها؟ شنو الكلر هذا اللي تشوفونه هنا؟
دكتور ميكونيوم يعني بلاك؟
ميكونيوم ايوه ميكونيوم يطلع من الاستمك. شنو هاي؟ اكو يعني ريتروجريد بيرستال لا هذا البلاك كلر او الدارك كلر ممكن يكون انت لازم اذا واقف راح تعرف بالضبط عليه. ممكن يكون هذا بايل ستين فوميتنج، وممكن يكون لا مو بايل ستين فوميتنج، ممكن يصير لك كافي جراوند فوميتنج اللي هو انديكيشن اوف GI bleeding upper GI bleeding. فهذا هو عنده coffee ground vomiting. طبعا هذا اكيد عنده citrus ulcer فسويت لنا coffee ground vomiting. هذا تشوفه coffee ground، هذا مو ميكونيوم بلاك، هذا بلاك براون coffee ground من اسمه. هذا تشوفوه هنا.
ذاك عندك كلينشت فيست يا لا طبيعيات؟
من هو هذا البيبي؟
ايه
لا هذه نورمال. زين
شكرا.
هاي شو تشوفون هنا؟ نشوف swelling of the feet، swelling of the feet وطبعا of the leg همينه. هاي يصلحوا له pedal edema. هاي البيدال edema ممكن نشوفها in neonates، يعني ذاك اللي حكيناه كان generalized swelling. هنا ممكن نشوف regional swelling بالفيت or بالهاندز. زين بالفيت او بالهاند من يكون edema نسميها pedal edema. نجي نشوفها هذه it is pitting edema or not. if it is pitting edema فهذه معناتها مبينه interstitial fluid collection. تمام لو لا؟ والكوزز عرفناها ونعرف هواي كوزز. لكن اذا لقيناها non pitting edema شو نفكر؟ non pitting edema
دكتور هايبوثايروديزم؟
لا. non pitting edema معناتها lymphatic obstruction. بنشوف non pitting edema معناتها lymphatic obstruction. lymphatic obstruction معناتها اكو مشكله especially if this baby is female، لان هذا معناته البيبي عنده Turner syndrome. Sometimes the only presenting sign of Turner syndrome at the neonatal period is the pitting edema. راح ناخذ سيشن نحكي بيه على Turner syndrome، بس sometimes the only presenting is just the pitting the non-pitting edema. nails صاير لونها yellow. This is a sign of meconium staining. إذا يصير before delivery meconium passed, the baby passed meconium, the meconium will stain his body. طبعا هاي أكثر شيء نشوفها وين؟ بالبوسترن babies. ممكن and it may stain the body, the skin, the vernix caseosa like this. So all these are meconium staining. هاي كلها موجودة الميكونيوم staining. وشوفوا وياها signs of pulse match. هذا اللي نشوفه هنا الابنورمال bluish discoloration. This is not ecchymosis. This is not bruising. This is a normal finding seen on neonates called Mongolian spots or sometimes called Mongolian blue spots. تشوفها على trunk on the gluteal region and sometimes it extends to the thigh. It is more common in dark skin babies more than the faint. And it of course take time to resolve, not extend with the same depth or intensity with time. هذه هو المنغوليان spots. هاي اللي نشوفها هنا in this slide. This is a reticulated skin appearance. Reticulated يعني like the mesh like مثل الشبكة صاير. Mesh like on whole body. Sometimes we found it or of the skin vascularization. There is vasoconstriction, giving the appearance of the skin like a marble. Marble تعرفون شنو معنى الماربل؟ Marble skin appearance. شنو هو الماربل؟
منخل.
نعم؟
المنخل.
منخل. ماربل هو الرخام، الرخام، المرمر. وهاي المرمرة اللي نسميها احنا هاي كلمة لاتينية الأصل، بالإنجليزي صح لها ماربل، ودخلت اللغة العربية، ما عندنا باللغة العربية كلمة اسمها ماربل، لذلك لذلك هذا صح له كيوتس مارموريتا. كيوتس سكن هاي لاتينية المصطلح، ومارموريتا يعني هو المرمر، فالجلد الرخامي معناته هذا باللغة العربية، ويشرح له ماربل سكن appearance in the English. This a sign of neonatal cells, سرعتهم peripheral vasoconstriction or peripheral vascular instability, or sometimes there is a cutis marmorata, congenital cutis marmorata, يعني تصير congenital disease sometimes in babies. هذا اللي نشوفه هنا أيضا abnormal، هو مو abnormal normal طبعا، بس قصدي abnormal skin color، بس هو normal finding. هذا اللي نشوفه on the forehead، واضح هذا red color on the forehead، وواضح on the upper lid، وممكن نشوفه حتى on the base of the nose. شنو هذا؟ اللي هو فتيشي red color well demarcated discoloration of his face. شو يسموها هذه؟
دكتور بيرث مارك؟
يعني هسه تروح مثلا باكر تصيرون على جماعه اصدقائكم فيجيبوا لكم ابنهم تشوفوهم، فامه تقول لك مثلا امه مدرسه معلمه تقول لك والله هذا ابني عنده بيرث مارك، يعني تريد تقول لك هيك بيرث مارك، شو يصحوا لها؟
دكتور الوحمه؟
الوحمه باللغه العربيه، ويسموها باللهجه الدارجه عند النساء يصحوا لها التنساء. التنساء اللي يعطوها اسباب كثيره، مع الام الحامل اشتهت فد اكله معينه وما جابوا لها اياه، او باوعت وجه فلان، او ما اعرف ايش صار. هي بالحقيقه وحمه او هيمانجيوما، هي سمبل تايب اوف هيمانجيوما، ديرمال هيمانجيوما يسموها بالانجليزي زين النيفس سيمبلكس، او يصيحوا لها زين السامن باتش، او لها اسم يصيحوا لها الستورك بايت، كلها نورمال بيرث مارك. ستورك تعرفون شو معنى الستورك؟ ما يعرف شنو معنى الستورك؟
دكتور اللقلق؟
اللقلق هاي عندهم الاجانب فد فكره، وكنت ما اعرف شايفيها بافلام كرتون، لا احنا بايامنا موجوده، انه اللقلق يجيب الطفل حاطيه في فد بقشه معقوده ويذبه من المدخنه مالت البيت، وينزل من المدخنه الصبح يلقون الطفل جاي، هاي صار عندهم طفل جديد. هاي من افلام كرتون القديمه. فالمين يشيل الطفل اللقلق؟ يشيله من قصته، من وجهه، يشيله من رقبته، يعني دا نشوفها on the back of the neck، يصح له ستورك بايت يعني عضة أو نقرة اللقلق، أو يصح له السامن باتشز. هاي مو سالمون، مو سمك السلمون، هو نفس بس السامن الألمت اللفظ، يصح له السامن باتشز، أو يسموها نيفس سيمبلكس. هذه with time resolved، ما راح تظل بنفس الانتنسيتي، اللي خصوصا اذا تجي بنيه والاهل يخافون وشلون خطيه وهذه عندها وحمه راح تشوه شكلها، هي بالحقيقه it will resolve with time. اكو عندنا another يعني ممكن ما تروح نهائيا بس تصير very faint. اكو عندنا another type of birthmark or capillary hemangioma، ولكن هذه تصير deeper، تصير distortion of the capillary زين، اسمها البوليميوس. ذيك سمبلكس كانت هاي فليميوس. هاي نشوفها on the forehead، أو ممكن نشوفها on the cheek، on the with the dermatomes of the شنو هذا النيرف اللي يمر مننا؟ which nerve؟ trigeminal nerve، الفيفث cranial nerve، ويصير ويا الزيغوماتيك branches of the trigeminal nerve. هذه in most of the cases تكون just a birthmark of skin of hemangioma، بس تكون شبيها شوي deeper وتصير يعني تستمر for life. لكن sometimes it may associated with underlying disease, with CNS disease، وتكون هذه neurocutaneous manifestation of this disease like this. شنو هو هذا الديزيز؟ الديزيز هو Sturge-Weber disease or Sturge-Weber syndrome. In this Sturge-Weber راح يصير اكو intracranial calcification، وراح يصير mental retardation، وراح يصير seizure on those baby. ويصير عندهم this neurocutaneous manifestation اللي هي هنا ما يظل اسمها port wine stain ولا يظل اسمها nevus. يصحوا له ترام تراك appearance مثل سكة القطار تبين. Another abnormal or other normal بالحقيقة، بس هي discoloration of the skin. We can see it on the limb or we can see it more on the trunk on the back. يصحوا له كافي أولي spots. كافي أولي كلمة فرنسية تعرفوها معناتها القهوة بالحليب. هذه ممكن تكون ممكن تكون just birthmarks وتعتبر minor anomaly. هاي راح نجي على minor anomaly less than 3 in faint skin babies or less than 5 in normal or dark skin babies. لكن إذا صارت أكثر ممكن تكون sign of CNS disease، لازم ندور عليه احنا نشوفه عند البيبيز، لان ممكن ما عنده presentation just this neurocutaneous manifestation اللي هي يسموها النيوروفايبروماتوسيس اذا كان النمبر larger than 3 or 5. هاي اللي تشوفوها هنا اسمها sacral dimple. Sacral dimple هاي اللي تشوفوها هنا هذه another minor anomaly can be seen in normal healthy newborn، لكن ممكن تكون sign of internal abnormality neural tube defect إذا كانت other presentation. If it is just sacral dimple, there is no hair tuft like this، هنا ما عندنا hair tuft and it is within 2.5 cm of the anal orifice، هذه normal تعتبر minor anomaly. لكن إذا لقيناها out of these characteristics ممكن تكون sign of spina bifida or يعني السباينا بيفيدا أكلتا أو نسميها المينينجومايلوسيل، يسموها sacral dimple.
عفوا دكتور وياها منغوليان سبوت هاي؟
اي عندها منغوليان سبوت. هاي اللي نشوفها هنا this is ear. طبعا الاير اوف ذا بيبي الاوريكل ممكن ينولد الطفل ويكون preterm baby ويكون abnormal shape of the auricle، لكن with time يعني تيجي تشوف الطفل انت انولد اليوم تلقى abnormal shape auricle، تيجي تلقى after 5 days 10 days صايره normal، صايره fully mature. هاي normal ممكن نشوفها بالبريتان بيبيز. فهذه normal shape of ear، لان عندنا هاي 7 باوع على الاوريكل راح نشوف هذا الهيلكس والانتي هيلكس والتراجس والانتي تراجس والايرلوب موجوده، لكن الابنورمال هو هذه اللي نشوفها بري اوريكولار اللي يصحوا لها بري اوريكولار سكين تاج. هذه بري اوريكولار سكين تاج ايضا ماينر انومالي ممكن نشوفها النورمال هيلثي نيو بورن. بعد ايش عندنا ممكن نشوف هذه هنا
العفو دكتور صوت ماكو؟
ثانية ما شرحنا.
وصلنا للتاج، ماشي. خلينا نرجع نعيدها على السريع. هذه شفتوها البت، هاي البت preauricular بت شفتوها؟
هو وصلنا لهاي يعني تشرح بها ونطفى. الهاي وصلنا يعني هي بس ما شرحنا.
هذه normal finding كذلك ممكن نشوفها. هذه أيضا minor anomaly can be seen. هي مو normal finding، هذه يعني normal finding معناتها نشوفها عند كل الأطفال، لا هي minor anomaly can be seen in normal healthy baby اللي هي pre-auricular skin pit. طبعا ما راح ناخذ سيشن اوف نيوناتال ان شاء الله الاسبوع القادم اوف نيوناتال اكزامينشن، راح نحكي presence of minor anomalies or association of major anomalies according to the presence of minor anomalies، يعني العلاقه بين الماينر and major anomaly. هاي اللي تشوفوها هنا، هاي الوايتش دوتس موجوده على السكن of the mandible, of the cheek, of the nose, above the upper lip. هاي يصيحوا لها ميليا، والميليا مثل ما قلنا قبل شويه بس كان مقطوع الاتصال للاسف، هي keratinization or obstruction of the sweaty gland. يصير بها keratinization يسوي لي الميليا. ميليا normal finding in normal healthy baby. اكو عندي other normal finding or normal birthmark ممكن اشوفها يصيحوا لها ملاريا، مو ملاريا، ملاريا. هذه obstruction of the يعني معناته of the pilot skin. جنوب شرق آسيا بالبصرة يجوز عندهم يصير هواية المناطق اللي يصير wet high humidity. هذه اللي تشوفوها هنا اكو وايتش بابيول اون اريثيماتس بيز، مو مثل الميليا، الميليا ما بيها اريثيماتس بيز. هاي هنا اكو اريثيماتس بيز، ممكن تكون ديسكريت، ممكن تكون جروب اوف بابيولز توجذر، ونفس الاريثيماتس بيز تجمعها لايك ذس مثلا. And this is called erythema toxicum, and unlike its name, it is benign condition seen in the first or second day of life, will extend on the first week of life, will resolve spontaneously. Baby يكون healthy, wealthy. هاي اللي تشوفوها هنا inside the mouth, the junction of the hard and soft palate. This is another form of the media. Cellular retention keratin cyst، لكن هذه موجودة inside the oral cavity، ما موجودة بالسكن. هنا ما يسموها ميليا، يصيحوا لها ابستين بيرل اللي هي معناتها بالعربي لولوات ابشتاين. وهذه نورمال فايندينج. دائما يجونا اهل يقولوا لنا عنده حلقه ما ادري شنو فطريات، عنده التهاب، بالحقيقه هو ابستين بيرل. هذه اللي نشوفها هنا هي natal teeth. natal teeth sometimes baby born with natal teeth اللي هو decidual teeth. most of the cases cause no problem ويروح واحده بعدين يوقع من واحده او ينتهي زين من يجي وقت التيثينج و have no problem. لكن sometimes it may be like this causing a problem. The problem is painful lactation or cracking and sore of the nipple of the mother. ممكن هذا الديسيجوال teeth يصير easily dislodged ويسوي لي suffocation and upper airway obstruction, so it should be extracted. هذا البيبي اجاني وكان this type of teeth، فI referred the mother for the dentist على مود يصير extraction of these يعني harmful teeth for the baby and for the mother. انتهينا. هالمرة ويانا؟ لا رحتوا بعدكم؟ جيد، موجودين. شوفوا طلاب. اوكي السيشن خلص هسه، السيشن انتهى.